I've had my transplant almost 28 years now, so I've spent a lot of time in hospitals. The not knowing is the worst part. The fear of the unknown, it can be terrifying.
I think the biggest challenge is time. We have a lot of patients on our list and a lot of things to do to take care of that patient every day. It'd be very easy to move from one patient to the next to be more efficient, but sometimes it only takes a minute to make that phone call and give that update to make a big difference.
Your mind is always racing. You're thinking of things like, what are they going to do to me next? Or how's it going to make me feel? Or what if it doesn't work? What are they going to do then? And because I have so many health issues, I'm always wondering, well, if they change this one thing, how's it going to impact everything else? And is this doctor going to know that the other doctor's going to do it? So it's like, all that's going through my mind. Then I start thinking about work, all the projects that are piling up at work. Oh, but then all the projects that are piling up at home while I'm sitting there in the hospital. Then I start thinking about my wife, because it's really tough on her. And, how is she going to manage when I get home if I can't help? I can't go through that again. It's really tough.
Sometimes it is hard when patients are questioning you about their loved one's care, but I think the important thing is to realize that they're asking because they truly don't know, and they want to be educated on their loved one's disease process or what the plan is. And I've always found that even though it may be difficult or uncomfortable, you have to realize that you are the expert that they're turning to in that situation.
Engaging our patients and families is critical for providing quality care. Research shows that engagement increases care understanding and compliance, improves clinical outcomes, reduces callbacks, errors, and repetitive patient education, reduces diagnostic testing and referrals, reduces length of stay and readmission, and decreases litigation and malpractice claims. How do we foster engagement? So how do we get to a culture of patient and family engagement? Across the network, we are already utilizing communication tools like TeachBack and Roadmap. You'll also notice communication boards in every patient room. These boards are a highly visible centralized area for patients, family, and staff to share information. Collaborative rounding is another tool that addresses both patient and clinician needs. And now comes skill building. These simple reminders will help us engage our patients and their families in a way that highlights our skills and enhances quality. We all care about our patients and want them to get well. So does the doctor in this scene. Pay close attention to how she communicates.
But how are you feeling today?
Good morning. I'm Dr. McGetty. I'm a hospitalist. Are you having a better day today? Are you having any nausea or chest discomfort?
No, I'm not.
Your nurse told me you had trouble sleeping last night.
Yes, I did.
Would you like me to order a sleeping pill for you tonight?
Well, that's great if you think it would help.
Oh, yeah. Well, your heart failure is improving and you're breathing better today. Once we have the results of the echocardiogram, I'll discuss more of the plan with the aortic stenosis with you. Do you have any questions?
No, I don't. I usually do, but when the doctor comes, I forget them.
That's okay. I'll see you tomorrow.
All right.
Now, let's watch the same scene from the perspective of the patient.
But how are you feeling today?
Good morning. I'm Dr. McGetty. I'm a hospitalist.
Who is this doctor? I thought my family doctor was going to see me.
Let's retry this.
Come in.
Good morning, Mr. Smith. My name is Dr. McGetty.
Nice to meet you.
And who do you have here with you?
Well, this is my daughter, Jenna.
Hello, Jenna.
Morning.
I'm a hospitalist. Here's my card. My partners and I will oversee your care while you're here. You met one of them yesterday, Dr. Mulcahy. We're internal medicine doctors who take care of patients in the hospital. Your family doctor, Dr. Wirtz, will continue to see you in the office, so we'll be covering for him.
Now, let's keep watching from the perspective of the patient.
Are you having a better day today? Are you having any nausea or chest discomfort?
I don't think she's even listening. She seems like she's in a hurry.
Remember, actions contribute more than words. From your patient's perspective, simply sitting at eye level makes it seem like you're spending more time with them. Also, by asking open-ended questions instead of yes or no questions, you'll encourage your patients to share details that can help you provide better care. Let's retry this.
So is Mr. Smith okay, or do you prefer something else?
Oh, you can call me Alan, everybody else does.
Okay, Alan. So how are you feeling today?
Well, when I get up to go to the bathroom, I'm short of breath.
I see.
By simply rephrasing the question and making eye contact, Dr. Moghetti got the patient to share. Now, let's continue to review the interaction.
Your nurse told me you had trouble sleeping last night.
Maybe I should just tell her I couldn't get comfortable. That I felt short of breath all night. But that's probably normal with being sick. And she seems so busy, so I won't bother her with it.
Again, by not asking open-ended questions, Dr. Moghetti did not draw this added information out of the patient. Also, because she appeared busy and had not established trust, the patient did not feel comfortable volunteering the symptoms. Here's another approach.
Your nurse told me you had trouble sleeping last night.
I was very uncomfortable. When I sat up in bed, it was okay. But once I lay down, I was short of breath.
I'm sure that was frustrating. Unfortunately, it's a common symptom of uncontrolled heart failure or fluid in the lungs. We need to remove that extra fluid, so starting this afternoon, we'll give you a second dose of the diuretic, or what's commonly called a water pill. Let your nurse know if you still have trouble breathing tonight.
Did you notice how Dr. Moghetti improved her communication? First, she built more trust by acknowledging the patient's discomfort. Then, she asked an open-ended question and encouraged the patient to share by looking into the patient's eyes and nodding as the patient spoke. As a result, she gained valuable information that changed the care plan and will ultimately produce a better outcome. But that's not all. Because she quickly explained the reason for the extra diuretic, the patient will not be surprised or anxious that afternoon. And finally, she concluded by encouraging the patient to continue sharing. She managed to accomplish all of this in just a few extra seconds. Let's continue to review.
Once we have the results of the echocardiogram, I'll discuss more of the plan with the aortic stenosis with you.
What is an echo? Is that a procedure? Will it hurt?
Arterial sclerosis, what's that? I wonder if that's what Uncle John had. I don't know what I'd do if Dad needed surgery.
The terms and tests that are second nature to us may be foreign to our patients. This lack of understanding could lead to unwarranted fear and anxiety. A short, simple explanation can greatly reduce those fears. Let's retry this.
If you can sit up for me. All right. So when I listen to your heart, Alan, I hear a soft murmur, which is like a whooshing sound. I suspect it may be due to aortic stenosis, which is common as we age. It's a tightening of one of the valves in the top part of your heart. The treatment depends on the degree of tightening. In most cases, we just monitor it and there's no need for surgery. To tell us how your heart valves are working, we've ordered a test called an echocardiogram, or echo. Are you familiar with the test?
No, I'm not.
Well, it takes about 30 minutes, and because it uses sound waves to create a picture, it won't hurt. Your echo will be done later today. As long as the results are back, I'll review them with you tomorrow.
This interaction appropriately sets proper expectations and discusses the next steps. Dr. Moghetti uses plain language to explain necessary technical terms. Also, by asking how much the patient knows, she makes sure she does not waste time and possibly insult the patient with an unnecessary explanation. Let's continue to analyze the interaction.
Do you have any questions?
No, I don't. I usually do, but when the doctor comes, I forget them.
That's okay. I'll see you tomorrow.
All right.
Many times, in the moment, our patients have difficulty remembering their questions. Or if we give the impression we are in a hurry, they may feel uncomfortable sharing their questions or concerns. This is where tools like the communication board or roadmap can help. These are places where patients or family members can write down questions as they occur. Let's try this again.
Do you have any questions?
Not right now. Usually I do for the doctor, but when the doctor arrives, I don't have any.
That's okay. I see here on your roadmap that you're wondering why we increased your metoprolol. It's because your blood pressure had been higher than we'd like it to be. In rare cases, increasing this medication can make you feel a little lightheaded, so let the nurse know how you're feeling. Do you have any other questions before I go?
No, I do not. Thank you.
Well, thank you for sharing. I'm going to go make that change to your water pill, and I'll reevaluate you in the morning. I hope you sleep better tonight.
So do I.
Rather than simply leaving, notice how Dr. Moghetti ended with a quick recap and words of encouragement. So there you have it. Dr. Moghetti was able to strengthen her communication through a few simple behaviors: a welcoming introduction, encouraging body language and open-ended questions, brief explanations, and clear expectations and next steps. Although the interaction only took a few minutes, it had a powerful impact, including increased trust, which led to more information sharing, potentially a reduced length of stay, and ultimately a better outcome. Her patient is better educated, which reduced the patient's anxiety. It also means less callbacks and less untimely paging with follow-up questions. Because the patient understands his care plan better, it may also reduce the chance for readmission down the road. All these benefits of improved communication add up to one thing: improved quality. It's the difference between good care and great care, and it all starts with you.
The summer before my senior year of college, there was an outbreak of hepatitis in the dialysis unit, and at that point, a couple people actually died. The nephrologist covering the unit during all of this had the nickname of Flash. That's what we called him. He was in, he was out, and he really wasn't giving me any helpful information or addressing my fears in any way.
I think that the patient and the family is part of the team. And if they don't understand the disease process in their terms, it's harder for them to understand where we're coming from.
One day, Flash's partner came through and changed everything. Right away, he put his hand on my shoulder and he said, "It's not unusual for hepatitis to take this long to get better." Then he explained why, and then he ended by saying, "You're going to be okay."
I have found that ultimately it is so important to engage the patient and the patient's family in their disease process, in their care process. And when you take that time, it is so appreciated and helps lead to a better outcome.
It's been almost 30 years, and I still think about that conversation. I'm telling you about that conversation. That's how powerful it was. It was brief, but at that moment, it was exactly what I needed to hear. And to me, that's what it's all about. That's the power of communication.